So it's a common misconception that urology is just a field for male reconstruction or male health. But actually, urology is the study and the management, surgical and medical, of the kidneys, ureters, bladder, and urethra. The plumbing may be a little different in women, however, women do have all those organs, and their care is just as important as men's. So female reconstructive urologists manage prolapse, which is the female organs maybe descending, incontinence, which is the leakage of urine, but we also manage patients that have neurologic problems that affect how their bladder works. We also can manage general urology indications, including kidney stones, blood in the urine, and so the field is very vast and it's very exciting. Frequently, patients may come and see us and not talk about some of the issues that are impacting them, such as incontinence. It's a little bit embarrassing. People don't know who to ask, and a female urologist can provide some of that insight, discuss the problem, and come up with treatment plans that are great for the patient, and importantly, are what the patient wishes to do, not what the doctor says they should have done. Women do, in general, have gynecologists that they see on an annual basis, and they address a lot of female complaints. However, some of the conditions aren't asked about, like incontinence or even prolapse necessarily, and that's when a urogynecologist or a female urologist can be beneficial because it allows the patient to discuss those very sensitive topics with people that are experts. I frequently get asked what's the difference between a urogynecologist and a female urologist. And I tell them that we're very comfortable, female urologists are very comfortable with the urinary system. So we have a unique ability in terms of reconstruction. We also manage neurogenic bladders, or bladders that are affected by nerve issues. And that's something that the urogynecology team isn't as experienced in. In addition, we are able to navigate other urology conditions such as kidney stones and hematuria, or blood in the urine. So all urologists are trained in the management of the GU system, but female urologists are specialized and they spend fellowship training learning how to manage conditions of the bladder and the urethra tube. There are some female urologists that do male reconstruction, but the focus really is on women's health, sexual function, as well as overall quality of life and function. So there are differences, although many general urologists will treat female indications. And the reason is that we have a lot of patients who are women and we have very few specialized female reconstructive surgeons. Patients want to know when they should contact a female urologist. And I say anytime you're experiencing issues that may significantly impact your quality of life and they're related to the urinary tract. So that can be incontinence, that can be prolapse, that can be urinary retention. And so we are able to very acutely deal with those particular problems because of the extensive training that we've had. Women really think that sometimes they should manage these issues such as incontinence and prolapse and never really speak about it. I have seen so many patients come to my office and with very small either procedures, medications, and interventions, we're able to greatly improve their quality of life. And I've had patients come back to me and say, I wish I would have done this 10 years ago, 20 years ago. So it's important to think about your quality of life and realize if you can make change, maybe you should think about making that change now.